In this video, we'll discuss several different forms of psychotherapy, including what makes each approach unique, as well as a few of the techniques that each approach uses. We'll end with a brief discussion on the relative effectiveness of these approaches, as well as the three factors that determine whether therapy will be successful for a given client. The first form of psychotherapy we'll discuss comes from our good friend Sigmund Freud and is known as the psychodynamic approach to therapy. This is an intensive form of therapy that can often last for several years. Freud believed that psychological problems are often the result of things like childhood trauma and repressed impulses. Think id, ego, and superego, which we learned about in relation to personality. The goal of the psychodynamic approach, then, is to bring these problems to light, to make the unconscious conscious in Freudian terms, and to find balance by decreasing the guilt associated with those repressed impulses. In psychodynamic therapy, the therapist is kind of like your dentist. The therapist helps to find a problem and to treat it, much as a dentist would do with a cavity. Historically speaking, psychodynamic therapy has relied on several different strategies, including free association, a technique in which the client expresses themselves without censorship. And that without censorship component is really important. The client should feel free to say whatever they're thinking. Relatedly, resistance. Resistance often comes up during free association, as the person's ego might block them from expressing what they perceive to be unacceptable urges or painful internal conflicts. And a good psychoanalyst picks up on this resistance and challenges it. Third, we have dream analysis, which is exactly what it sounds like, analysis of the content of the client's dreams, what could they mean? And finally, transference. This is a little bit more difficult to understand, but it's the projection of the client's own feelings onto the therapist. For example, let's say the client has issues with their father figure, their parents. If the client starts to sort of project their feelings of that onto the therapist over time. For example, over the course of several years, they start to view their therapist as sort of a father figure. The therapist might pick up on that and use that as a jumping off point to discussing their parental issues. This is transference. So that's psychodynamic therapy. Next, we have person-centered therapy, which is also called client-centered therapy or Rogerian therapy, after Carl Rogers, the psychologist who developed the approach. Person-centered therapy is considered to be part of a broader orientation known as humanistic therapy, which is focused on helping people achieve their full potential by becoming more self-aware and more self-accepting. Think of a Rogerian person-centered therapist a little bit like Barney. Basically, the therapist is your BFF, your best friend forever, a supportive friend that is simply there to listen to you and to help you process your thoughts. This is a non-directive form of therapy in that the therapist doesn't actually offer any advice. Instead, the therapist treats the other person as their equal, just someone to talk to, and assumes that the person will get better on their own through the process. This approach to therapy involves several key principles, including unconditional positive regard. This is really important in creating a safe space. Unconditional positive regard involves avoiding any kind of judgment in regards to what the client is saying. And this is really important for all the things that follow. Empathy, a second principle here, understanding and sharing the client's expressed feelings. This is really important, again, to creating a safe space and to showing that you understand what they're saying and what they're going through. Third, we have reflection. This is a restating of the client's thoughts. Again, you're not actually providing any advice here. You're not telling them what they're thinking or interpreting their thoughts or telling them what it means. You're restating it. You're just identifying that. In so doing, helping them to really bring it to the forefront, to understand it, and to be able to process it. This is reflection. And finally, we have congruence. The therapist's positive comments should match his or her actual thoughts, feelings, and actions. This is basically the principle of being sincere, and it again connects to this idea of creating a safe space for the client. Another form of therapy that stems from the same humanistic orientation but that looks quite different in practice is Gestalt therapy, developed by German psychiatrist, psychoanalyst, and psychotherapist Friedrich Perls, better known by the nickname Fritz. Gestalt therapy is somewhere in between psychodynamic and Rogerian therapy. We're still focused on treating problems, but it's different from the psychodynamic approach in that we're now focused on the here and now, and we aren't really interested in delving into past experiences that may have caused the current problems. Gestalt therapy is humanistic and client-centered in that its overarching goal is to help the client become a whole person. You'll see what I mean by this when I tell you a few of the techniques a Gestalt therapist uses. So first we have pointing out inconsistencies in the client's thoughts or behavior during a therapy session. And going along with this, pointing out body language and kind of trying to interpret what the body language means, and is there inconsistency there as well. For example, let's say your client is saying they're not anxious about something, they're not worried about something, or this isn't causing them a problem. That's not the issue. If they're saying something like that, but at the same time they're twiddling their hair or rapidly tapping their foot on the ground, again, the therapist might point this out and say, well, you're saying you're not anxious about this, but your behavior is telling me something different, so let's talk about that. A final technique that I'll mention is practicing role-playing, again as a way to either point out inconsistencies or just work through problems. Cognitive behavioral therapy is the last form of therapy we'll discuss here. This is CBT, cognitive behavioral therapy, and it assumes that our beliefs about a situation play a crucial role in determining our feelings about it, which in turn determine how we respond to that situation. So this connection between thoughts, feelings, and behavior. CBT relies on learning principles to change the way we think, that's the cognitive aspect, and therefore how we act, that's the behavioral aspect. I'll note that there are several forms of therapy called, for example, cognitive therapy and behavior therapy, and these are separate. You'll see aspects of them in CBT, but they're different. For example, cognitive therapy focuses on how a person's thoughts can lead to feelings of distress, and CBT focuses on this as well. Behavior therapy is all about using learning principles, as we've seen with CBT, and techniques to modify problematic behaviors. For example, exposure therapy and classical conditioning, in which a therapist tries to create more positive associations with an anxiety-provoking stimulus by exposing the client to that stimulus. Again, a cognitive behavioral therapist might use these strategies as well. Just to reiterate, CBT begins with the understanding that thoughts create feelings, that feelings create behavior, and that behavior reinforces thoughts. If a person's thoughts are negative, their feelings about the situation will be negative, and they will behave in ways that they'd prefer not to. Cognitive behavioral therapy is all about breaking this negative cycle. One of the first forms of CBT was rational emotive therapy, or RET, developed by Albert Ellis as a response to Freudian psychoanalysis. Rational emotive therapy assumes that behavior is caused by how a person thinks about an event, not by the event itself. As an example, take a student who receives a bad grade on a midterm exam. The student might take this grade as evidence that they're unintelligent and will be unsuccessful in school. Hopefully it's clear to see how this perspective, this thought, would hurt the student's self-esteem and could lead to anxiety or even depression about their abilities, and the student might give up and do even more poorly in the future, which would only reinforce how they feel about themselves. At the same time, however, the student could realize that they simply didn't study hard enough for the exam, and that next time they can do better by maybe putting in more effort or trying different study strategies, or perhaps reaching out to their professor for help. In this case, the student's self-esteem is preserved, and it's much more likely that they'll succeed next time with this perspective, with this different thought. So the same situation leads to a very different outcome because the student changed the way they thought about that situation. Rational emotive therapy is all about actively shifting negative thought patterns in this sort of a way. Okay, so which approach to psychotherapy is best? The good news is that research shows all of these approaches to be effective, and there isn't really clear evidence to suggest that any one approach is better than the rest. According to the American Psychological Association, treatment will be successful if, number one, the treatment is evidence-based, as all of these are, number two, the therapist is experienced, and number three, you begin treatment with the belief that your problems can be resolved.